Good afternoon. Thank you everyone for joining us today. My name is Sean Moore. I am the Manager of Special Projects and Initiatives at the Community Anti-Drug Coalitions of America. And we're here today with Ashley Bodyford to discuss community readiness and organizational capacity. It's going to be a great webinar today focused on really how can we save those efforts that our community members are putting forward in our initiatives and make sure that we're doing the right level of work for the intervention, for the impact that we want to create. And Ashley, if you could go ahead and forward the slide. This work is being conducted as part of a grant from the Substance Abuse and Mental Health Service Administration. The State Targeted Response Technical Assistant Grant was created, and it is now operating under the name the Opioid Response Network. And our goal is really to assist those STR grantees, individuals and other organizations in the communities that they serve, by providing resources and other technical assistance that they need to really build capacity around the work that they're already doing in their local communities and help connect to other initiatives so that everyone working in this field can have a greater impact on their work on the opioid crisis. Technical assistance is available to anyone. That technical assistance is free of charge to the recipients. And again, that this is all being paid for via SAMHSA grant, and so that is a free resource for you to use. Ashley, the Opioid Response Network provides local experienced consultants across the fields of prevention, treatment, and recovery to communities and organizations for their work. And those requests can be submitted, we'll see their website in just a second, at opioidresponsenetwork.org. This is completely open to the public. Any individual can submit a TA request. Every single state across the country, including the US territories, has a designated team led by a technology transfer specialist, supported through the Addiction Technology Transfer Centers. And they have sort of designated people locally working in prevention, treatment, and recovery. And we're also able to draw from the expertise of our partner organizations, expertise of in specific consultancy areas across the country. So it's really a great resource for your work. Could we advance slide? Here's the contact information for the Opioid Response Network. It's very easy to remember. Our grant is led by the American Academy of Addiction Psychiatry, or AAAP. So ORN, Opioid Response Network, at AAAP.org is a way that you can get in touch with any questions. Of course, as this is funded by a grant, we need to say that this is made possible by the grant, though the views expressed by myself or by Ashley during the webinar are our views alone and do not necessarily reflect the views of the Department of Health and Human Services or SAMHSA. And you could advance slide. And advance slide again. So during the webinar today, we won't really be making use of the raise hand function if you see that in your version of the Zoom software. But please do make good use of the chat. If you want to send a chat message, you can either chat myself and Ashley directly, or you could use the designated Q&A function. We will be addressing questions towards the end of the webinar, though not as much during the webinar itself. So again, we're not really going to be making use of that raise hand function, but we will be using the Q&A. And if you'd like to send a message to everyone, please use the chat box. If you have any questions about today's webinar or any upcoming webinars, please do feel free to email me, smoore@cadca.org. I will be sending out a PDF of today's presentation along with a link to the recording of it, which will be posted on CAGCA's YouTube channel. And I'd like to introduce you all to Ashley. Ashley Bodyford is the Regional Capacity Coach at LRADAC for Region 2 of South Carolina, in which she provides training, coaching, and technical assistance to help to ensure readiness for implementation of the Strategic Prevention Framework. At LRADAC, she has also served as the Alcohol Enforcement Team Coordinator for the 5th and 11th Judicial Circuits, in which she developed and implemented evidence-based programs to reduce underage drinking and impaired driving. She also serves as a TA consultant with the Opioid Response Network State Targeted Response Consortium. Ms. Bodyford has worked in the field of substance use prevention since 2010 and is skilled in universal, selective, and indicated prevention strategies. She enjoys bringing insight to the field of prevention through innovative techniques and collaborating with community partners. She serves on several key statewide task force and committees. Ashley has provided training and technical assistance in the area of alcohol, tobacco, and other drug prevention, cultural diversity and competence, community coalition building, needs assessment, implementation strategies, and other prevention-related topics. She's a certified senior prevention specialist, a certified trainer for the substance abuse prevention skills training, prevention ethics, and the Palmetto Retailers Education Program. She has also served as a trainer for the Underage Drinking Enforcement Training Center under the Office of the Juvenile Justice and Delinquency Prevention in Washington, D.C. Mrs. Bodyford has served on the South Carolina Association of Prevention Professionals and Advocates Board for several years and currently serves as the organization's president. Mrs. Bodyford holds a Bachelor of Science degree in developmental psychology and a master's in public health. In 2012, she was named the recipient of the Jan Oglietti Rising Star Prevention Professional Award for outstanding contributions to the field of prevention, and in 2016 was named the recipient of the Norman Peter Johnson Outstanding Prevention Professional Award. Most recently, Ashley was named as the subject matter expert by ICNRC and was tasked with item writing for the Prevention Specialist Credentialing Exam. So without any further ado, I'd love to introduce Ashley. And again, I'll be speaking with you later as we take questions at the end. Thank you, everyone.
Good afternoon, everybody. Thank you so much, Sean, for that introduction. I am very excited to be with you all this afternoon, talking through a topic that I certainly enjoy practicing, but also helping others kind of reach the potential to achieve some outcomes through. So for today, I really wanted to focus our time on just a couple objectives and really spend some time building some understanding and knowledge around community readiness and what that truly means. So for today, we're going to spend our time talking about the Community Readiness Model and really understanding how we assess our community's readiness levels, and then really talk through some specific steps and how we might increase readiness once we understand it, as well as understanding some steps to build that organizational capacity as well, kind of dually. And then really focusing in how we connect our community readiness levels with how we prioritize our strategies or interventions that we are going to implement as we kind of work our way through that SPIF model. So I'm excited for us to get started today and have some of those conversations. So thinking about community readiness, oftentimes this is something that we talk about, but sometimes can really be overlooked. And so really being able to understand that community readiness really is that degree in when we know a community is ready to take action on a specific issue. So a lot of times when working in our communities or our counties or our target groups, those key people are really expected to be responsive and oftentimes pretty quickly, right? So when something comes up, a new project or a new condition, it's a very prompt response. And so a lot of times those stakeholders or those sectors don't necessarily have the adequate time to adjust to new ideas or really even have the opportunity to gain knowledge themselves to understand what's going on. And so a lot of times that can produce some barriers that they can be worked through if done so intentionally. And so when we talk about readiness, really understanding that the range can go from none at all to also already having a group implementing successful programs and really making progress. And so for today, I want us to kind of focus on how we understand as well as measure kind of exactly how ready a community is to address that particular issue, and then how we move forward using that knowledge to really stimulate community change. So doing so, I'm going to talk a little bit about the Community Readiness Model. Some of you may or may not be familiar with this model, and this model was developed under the Tri-Ethnic Center for Prevention Research at Colorado State University. And so they really developed this model that helps identify certain dimensions as well as levels of community readiness. And we're going to talk through all of those in just a few moments. This model also contains a nice instrument for really being able to determine our community's readiness through kind of an assessment and an interview process, scoring, rating, et cetera, that community members can actually implement. So it isn't just for prevention professionals or professionals at all, truly. It can really be done through volunteer work and our community work when they've had some information about it. And we'll talk about that shortly as well. So when we talk about understanding a community's readiness, it's broken down into a couple of characteristics. And so what you'll see here is really understanding first and foremost that there is very much an issue specific for when it comes to community readiness. So a lot of times we talk about communities can be more than ready to address one issue, while also maybe not being ready at all to address another issue. So we're going to talk some more about that as well, but really being mindful that we're assessing community readiness as it relates to a specific issue that we are first dealing with, not so much lumping all of our issues together and assessing at one time. So being intentional that we are assessing specific readiness levels based on the problem that we're dealing with at the moment. Another thing to think about is that community readiness has the ability to be very measurable. And so, like I mentioned, we can have those varying levels of readiness, and we can use certain tools such as the Tri-Ethnic Centers model that I just showed you all, really being able to assess those levels, as well as being able to measure the changes in those readiness levels, so that if you're doing any type of reporting, there are ways to really communicate that increase in readiness levels have been met. So we'll talk about that too. Another interesting thing to take note of and be very mindful about is that community readiness also has the ability to vary across different dimensions. So what I mean by that, kind of like I mentioned earlier, that one community area might be ready to address one issue in some ways than other areas of community, as well as being ready to address one issue versus maybe another issue. There's a lot of reasons that it can be contributed to why something like that may be happening. It may just be that the community knows a significant amount of information about issue A as opposed to issue B, and kind of realizing the impact and the magnitude of the problem. And maybe they're just unable to really be able to identify some solutions that can be implemented. And so that may contribute to some lack of readiness. Or it could truly be that they really just don't understand the issues going on. So really us as professionals in this work are really tasked with making sure we are making the education and the information aware to those individuals so that they can be responsive to really what we're talking about, and not kind of coming at them with a plan or a strategy or a solution without really educating them on what's actually happening in the areas that they work and live. Also, thinking about community readiness can also vary across different segments of the community. So again, being mindful that some groups, definitely those ones that are directly affected by the issue at hand, maybe really are a lot more ready to address the issue, to work on the issue than others. However, there's ways to move through communities and increase those levels of readiness with some specific strategies. And being mindful that understanding readiness is essential for addressing the issue. So we can easily kind of diminish efforts by trying to push our community or our groups into something that they're not ready for, and really being understanding that people will support what they see as reasonable or logical that they can attain, right? So we may be proposing something that might mean those things or meet those requirements, but the community's perception might be otherwise, and we know that perception is reality, and so being able to understand that before we jump in can really help prevent some of those barriers from arising. So really understanding that as a professional, community readiness and having that understanding of it allows us to truly tailor our strategies to what the community is willing to accept as well as support. And being mindful and taking those small steps forward by setting those goals really can help make progress, forward motion, and moving forward, and not kind of rushing to a strategy and missing some key pieces. I mentioned earlier that there are dimensions of community readiness, and you'll see them here on this slide. There are 6 of them, and we are going to kind of dissect these as we move throughout and really get a better understanding of what these dimensions capture. But thinking about them first, just to share, we are talking about community efforts, community knowledge of those efforts, leadership, community climate, community knowledge about the issue, and then resources related to the issue. So being understanding of these is important, and we are going to break those down as we move throughout here, first starting with community efforts. And so specifically talking about and being able to answer the questions related to these dimensions. So for community efforts, what we're specifically asking is, to what extent are there existing efforts, programs, and policies that are already addressing the issue? It's really helpful to know this early on so that you're not repeating anything or attempting something that's already happening or maybe another group is working on, and really being mindful of where resources, both fiscal and time, are going in terms of planning and implementation. So being understanding of identifying what's happening in the community already, what's already going on to address the specific issue that we're being tasked to work on. Next is moving to community knowledge of those efforts. So kind of a deeper dive into the efforts topic here is really being able to understand about the extent that community members know about those existing local efforts and their effectiveness. Oftentimes we tend to forget about certain things such as this. So we may feel that we've developed great material to communicate and disseminate to our partners about what's happening, but maybe we've missed an area of the community, and so they would not know about existing resources or existing efforts. And really making sure that those efforts are accessible to all segments and sectors of our community is really important, as well as being able to share the effectiveness level so that community members know that certain things are happening and they are changing and they're making the community better. Next is leadership, and so this is very specific in making sure we understand what extent our appointed leaders and or influential community members supportive of this issue. We know that all stakeholders and all sectors are important, but we also know the importance of having change makers at our table, and so being able to understand and really know what level those leaders are at, and what's their stance on what we're working towards, and what type of education or partnership we may need to build with those specific people as we continue to make forward change in our communities. And then moving into community climate. So really understanding kind of what's that overarching attitude of the community towards this issue. Is it something that they've kind of been told or been privy to? Do they have specific personal firsthand knowledge and thought and information? Have they been directly impacted by the issue? A lot of different categories can kind of contribute to this specific thing. Is it really kind of the sense of the agency giving this information and kind of having the attitude premeditated, or is it truly public opinion? And really being able to understand the difference between those is really critical as you work through understanding the community readiness of the community that you're specifically working with on a specific issue. And then moving into knowledge, community knowledge about the issue. So making sure you understand what extent your community members know about the causes of the problem and consequences, as well as the impact. So again, kind of going back to talking about sometimes it might be that an issue is presented, but not a lot of but why or but why here information to go kind of attach with it, right? So we may be able to talk about X issue, maybe opioid issue happening, but perhaps there's not another follow-up statement as to why there's a certain issue in this community, and here are some things that we know are happening. So oftentimes making sure that we're able to communicate the issue, of course, but also kind of the magnitude, severity, trend, etc., that comes with those types of issues. And then kind of final dimension is that resources that are related to the issue. So really being understanding about what local resources are available to support these efforts. And really understanding that our community's status with these dimensions really is the basis of the overall level of readiness. So reminding us that readiness can vary, again, sometimes widely across these dimensions. So maybe some levels of efforts and resources might be very different. The levels really just describe how prepared your community is to tackle the question related to the issue as well. And so reminding yourself that community readiness level doesn't necessarily correspond to the level on other issues, like I mentioned just a few slides back, reminding us that readiness is issue specific and we should be assessing it specific to the issue at hand. And so talking through these again, specifically as it comes to how we assess across these 6 dimensions that I just shared with you all that you see on your screen, we kind of are really specific in understanding what we're asking to get these clear answers. So looking at these 6 dimensions, a few things that are noteworthy that would be helpful to be asking or to be understanding is understanding the makeup and the history of the community that you're serving and working with, and being able to provide some context with data collection around its current concerns. So there might be some specific things that you're assessing for, such as the types of information which best describes the community, such as demographics, the historical context of the community, maybe the political context of the community, who those key leaders are, who is really integral in making change and really of strong voice. What are some past concerns? Like, what has this community kind of already been through and dealt with, and what have they done, and what consequences have come because of previous issues? As well as what are some barriers? What have they already kind of been up against? And how do we make sure we minimize those barriers the best that we can by being aware of them ahead of time? Some other things to be asking as you're working through assessment is also your information sources that you're using to kind of collect that data, right? So public records perhaps, or maybe you're doing some archival data where that data has kind of already been collected and stored and you're reviewing. Also just those local people, just those community members, the people that make up that community who see it firsthand or who aren't seeing it firsthand. And making sure you're getting the perspective from the entire community so that it's representative and not just really segmented out is really important as well. And then being mindful about the resources, comment on whether there are sufficient resources. Do you have the time? Do we have the people to collect this information? And is it accessible? Also, the strengths and weaknesses, like I kind of mentioned, kind of tie out that kind of makeup and history of the community. And then moving into kind of that understanding what matters to the people in your community. So being understanding that the issues that they most care about, is it safety, education, health, and why? How important are they? Is it a perception of importance? Do they understand the consequences when things aren't at a certain standard? Being aware of that's really important as well. And then same thing for what matters to those key stakeholders. Not that either one is more important than the other, but sometimes those things can differ, and so it's helpful to know both. So when one stakeholder has made it aware what they care about, it's important to know what they care about, but who else cares about that issue? And what do they want to know about the situation that you're specifically working on? asking those questions ahead of time so you can be very prepared to have those conversations and be able to have those rich, worthy conversations and outcomes so you can begin to kind of assess that level of readiness. And also being able to talk through the evidence that indicates whether your specific problem should be a priority issue. So a lot of times community level indicators can help us with this, be it vehicle crashes, overdose rates, hospitalizations, etc. There's a multitude. How frequently that behavior is occurring with those consequences is very important, and we should be able to have those articulated conversations, as well as those barriers and resources like we mentioned. What barriers exist, what resources are already available, what's already being allocated to this work so that we don't duplicate or step on toes, and really do it as a partnership and working kind of in tandem with others that may be already working on it. I just would love to share a specific example from my work here about assessing readiness with you all just for a moment. And a situation that we had here locally where I am, several years ago, we were awarded a federal grant. It was an overrun of an existing federal grant, so we only had about 2 years to where we were able to work on some DUI reduction, specifically for crashes and fatalities in our community in South Carolina. So we knew up against it, we were on a very a very fast-moving time frame, and we had to get things done, right? We had to show our funder that we were really using those dollars. And so just with full transparency, because I think it's such a great lesson learned, we did not take any time to assess our community's readiness. We went right into implementation because we had a strategy that we had implemented for the same topic, or excuse me, the same issue in our sister county, which is truly right next door, and we saw success, extreme success. And so we just quickly got the people together that we needed, we implemented it, and the outcome was terrible, truly terrible. Just really met with a lot of negativity, a lot of resistance, a lot of really people kind of offended by some of the things that we were offering them, which really were just educational tools in regards to preventing over-service to merchants. But we had not taken the time to partner with those merchants and assess their readiness and get their perspective on things. And so it was such a missed opportunity because we neglected what we knew we should have done. There was partnerships that really needed some significant time to mend and move ahead. And we just really missed the mark on that one as well. And so I think about that often, and it reminds me, kind of takes me back to those initial core foundational steps of this work that we do, and how this readiness assessment is so critical to our success. It's just often overlooked and really can be detrimental. So speaking about community readiness, we are going to talk through these 9 levels of community readiness and kind of break them down like we did for the dimensions as well. And so first we're going to start with know awareness. And this, again, it's very kind of understanding that this issue is not recognized by the community or its leaders as a current problem. It's just not a lot of information. They just really don't understand. So there's just no awareness of it at all. Then you move to the next, denial, also resistance. And in this level, it might be that some community members recognize that there's a concern, but again, really is very little recognition that it's occurring locally. So a lot of times we might hear something is happening and our community might respond and say, well, that's happening XYZ place, not in our community or not in this area of our community. It's very common, it happens often. So that's what we mean about that denial or resistance level. Then moving into vague awareness. So knowing that most people are feeling that there is a local concern, but there really isn't a lot of immediate motivation to really do anything about it. So we know there's a problem and we're kind of letting somebody else handle that right now. Then we transfer to pre-planning. So this is really telling us that there's some clear recognition that something needs to be done and that there may even be a group already addressing it, but efforts aren't really focused or detailed. We're just kind of having those initial conversations. Then we move to preparation. So this is really where active leaders really begin planning. The community might start to offer some support, maybe not full-on support, might be pretty minimal or pretty modest, but there is some support there. Then we move to initiation. So just kind of enough information is available to really start justifying some of the things we want to do or want to start thinking about, and maybe even some activities begin to make way. Talking about stabilization here next. So this is where activities are really being supported by administrators or those county kind of decision makers, those key leaders we mentioned. And this is where we have some staff starting to become trained and experienced in the issue that we're dealing with, as well as some strategy to kind of make some changes and some headway with that issue. Then we're moving to confirmation and expansion. So we know efforts are in place. The community members are feeling comfortable with our services. They're supporting our continued expansion and growth. And we are really collecting local data, regularly obtained, it's evaluated, and it's making some shifts. And then that last level there, that community ownership. This is when that detailed and sophisticated knowledge really is existing about prevalence, causes, as well as consequences. We also are really having some very effective evaluation happening here. It's really helping us guide new directions. It's really helping us also use this same model for our other issues. We tend to notice that happens, right, going back to those shared factors, those shared risk or protective factors. Once we kind of have a nice grasp on something, we can then kind of move on and take on other things as well. And so we're using our same models to assess our community, build that capacity, make those strategic plans, implement with fidelity, and really do some strong evaluation, all while maintaining cultural competency and being mindful of sustainability at the same time. That's the overview of the 9 levels of community readiness. And so it's really helpful as professionals that we know what level our community is at. It's also really understanding for you all to know these things so you can plan your efforts around those levels. So if you have somebody at that vague awareness, expecting them to perform at confirmation is just really setting all of us up for poor outcomes, increased frustrations, and maybe even some dismissal of your community members who maybe once were interested in partnering with you kind of vacating and jumping ship because they're not feeling like they're being heard or supported or valued. And so really understanding where we are and kind of what we can do in those levels is really critical to our success and really making some changes in our community. It's also really helpful that once we know where we are, we can shoot for where we want to be, right? And being understanding that oftentimes people move one step at a time. It's just kind of general rule of thumb to kind of be mindful about. So if you have somebody, again, at maybe denial, just understanding that they're going to take time to go through each of these levels until we get to that great working relationship or where they're more comfortable with understanding what's going on. And so kind of expecting them to bigly jump is, again, really not a realistic expectation. So that one level at a time. So understanding the benefits behind the community readiness model is also pretty critical to the work that we do, and really talking through this in detail, being understanding that the community readiness model really does conserve our resources, those valuable resources, again, not just money, but time and people. So being able to select strategies that are more likely to be successful by using this model, really rather than kind of spinning wheels, trying to get the community to do something that they're not ready for. Again, like I mentioned, you and your community really aren't going to see those outcomes that you're hoping to see. You can really get up to speed quickly if you're starting in the right space. The second thing to be thinking about for the benefit is that it really is efficient. It's very inexpensive, cost-effective, and a great tool. Like I mentioned, it really doesn't take professional expertise to administer these assessment questions or score them, which we'll talk about here shortly. So being mindful that you can have some of maybe your key helpers working with you on this, And we know that it's effective and it can give us some really great information. It also really helps promote community recognition and ownership of the issue at hand. So because it can be used by the community member and because there's a recognition of the need as well as any assumptions of the community, the model really does make it easier for our community members to see the issue and understand its effects. Again, kind of going back to that consequences, the severity, kind of what's happening in our community firsthand. A big one here, because of that strong community ownership, building those people into the process, it really helps to assure that our strategies are culturally congruent and sustainable. So we're not taking on something that we know can't be sustained, at least in some capacity, and we can kind of have those conversations early on with our community members that we're invested in this work, and we hope to continue moving forward with our outcomes and our strategies at the same time. It also really encourages the use of our local experts and resources instead of relying on outside experts and resources, which we know can be very beneficial, but can also be very costly. So those might not be options for certain communities. However, this would be due to its inexpensiveness. So the local experts may not be experts in the professional sense, like they might not all be maybe certified prevention specialists, but that certainly is okay, because we're talking about having community members who now understand a little bit what's going on, but they also know their community. So they live there, they work there, they raise families there, whichever it may be. Those are the people that know our community. So having them involved in the administration of this model and gathering that assessment data can be really helpful as well. Also knowing kind of that process of community change can be very complex and challenging, but at the same time, that model really breaks down the process into a lot of manageable steps. So like I mentioned to you on the previous slide with the 9 levels, we're moving from no readiness to the highest level, knowing that's a very long step. And being able to understand and communicate to our community members that we know that moving from the lowest level to the next one up is much more manageable and it's understandable for us as well as them. And it really does create that community vision for healthy change. So being understanding that really the levels of readiness are mirroring the levels of community competency. And so that's really describing in some capacity how healthy your community can handle issues. So being able to really understand kind of the different levels we talked through and then the benefit for them really does broaden your sense of work and prioritization in your day-to-day. So you're not kind of taking on way too much or kind of missing the mark because your community is on one side and you're on the other. This model really helps kind of unify and really mesh beautifully what you're trying to accomplish. So when we talk about when we want to actually use this community readiness model, and really being understanding that the nature of this model does make it useful really in any situation where there's an issue that needs to be addressed. But there are some times when it can really be specifically or particularly useful, and that's what you see before you here. So truly it can be beneficial when you are monitoring your community's readiness. Of course, that was what the model was created for, so it makes perfect sense to be the first bullet here. But being intentional and understanding that if your effort is successful, your community will be moving forward, not only in dealing with the issue at hand, but again, just in overall readiness. So kind of when they're able to tackle things and see that there is some outcome and some success, it kind of helps reduce some of those barriers, right? So make sure that that continues to work. Make sure that members are accepting and being able to see the accomplishments and moving forward. And that's why it's so important to monitor that readiness and adjust your strategies and information accordingly. Also using this every time you tackle a new issue. We keep coming back to being reminded that readiness is issue specific. So it's important to really know where your community falls on each issue that you address using this model. So understanding that successful work on one issue may leave your community better prepared and more willing to address others. Or it could also leave members complacent, feeling like there's not much else to do. So just, again, being understanding that, using this each time you are tackling a new issue. Also, when you are dealing with different communities or different sectors of the community and they're all involved in one work, so we've already kind of touched on this, that groups within the community might really vary differently, and they might be from different levels on the readiness scale. So we kind of have to make sure those strategies can meet those levels in order to be successful. And when you're talking about your plans involving a participatory process, so really what level of participation are you expecting? Kind of knowing where you are starting so that you can reach your success. Like we talked about, being able to apply this model will help answer those questions. And then when you're really engaged in a community or a neighborhood planning effort, so a lot of times those efforts start with the assumption that everybody's at the same level, so it really doesn't provide them encouragement to move. So being able to have that close look at where the community or your neighborhood or whatever you're working in is actually starting in, again, can really speed up that process as well as broaden that involvement and really help increase those satisfaction with those results that you'll see. So talking about now is who should be involved in using this model. So when we talk about this, really in any use of this model, there's kind of two groups of people whose involvement is pretty crucial. And so you'll see here that that is specifically those who should apply and administer the actual assessment and those who should be surveyed when the assessment is being conducted. So let's talk about that. So talking about the first group, the who should use it. So you'll see before you some examples of some sectors that we would recommend use this model when they are working in planning or building readiness or beginning to start thinking about strategy, prioritization, and implementation. So focusing on those policymakers and planners. So those are the ones who have the power, right? We know that they can get things done, but sometimes they can tend to fail to think about factors like community readiness when they are really developing what they feel like is positive solutions for community problems. So they would be a great audience to use this model, as well as our community activists. So a lot of activists or organizers might recognize the importance of readiness, but without an assessment tool, they may only have their intuition to kind of determine where the community is starting from. So this is a nice, solid kind of, you can't really argue with what people say in terms of where they are. Health and Human Service Organizations is another one. Again, these groups are often the initiators of community efforts towards change or towards addressing issues. So knowing where to start such efforts is really essential to success. Coalitions, of course, so understanding community readiness in relation to their issue really does help coalition be able to plan and organize what they're going to address. And truly anyone else with interest in change, community change or social change, just having an understanding of the concept may really have valuable worth in community work that citizens are engaging in. And then thinking about the second group, who should be surveyed with this model. So just when we think about this question, you know, some extent depends on the nature of the issue. If it concerns youth, then youth should be among those that you're surveying. Other groups you'll see up here as well, really it's important to include them as well. So you'll see schools or universities, municipalities, your law enforcement, health and medical, your social service, mental health and treatment partners, clergy or faith-based community, youth, people on limited or fixed income, and your community at large. So truly it's really for everybody, but being mindful that you should be planning with the target group. So making sure, like I mentioned, if you're working specifically with youth issues, you for sure would want youth to be a part of the population that you're surveying in terms of readiness. And then how do we actually use that readiness model that we've been talking about this afternoon? And so truly there's a great wealth of information when you actually look at the Tri-Ethnic Centers model. So just some quick takeaways is that you really want to make sure that you choose and then train your interviewers, and being mindful that you are probably doing better to use interviewers who are members of the community and kind of who can be trusted. They want to have both criteria if you can. They don't have to be experts or professionals, again, like I mentioned, but they really should be comfortable with others, being able to kind of have those conversations, but also have some training maybe and some interview skills. So they should be familiar with the model so that they understand what they should be asking and recording. And then you have the scorers, and you would want to choose and train them. So the scoring is very specific, which you'll actually see in the model. And the scorers have to be trained to score it correctly and have a good understanding of the model in general so that they can score and then articulate what they found. And then, of course, you're conducting the interview. So best practice is to have between 4 and 10 people to interview at a minimum, and being understanding that those should be people who know the community well. They should really be chosen to reflect the perceptions of a number of segments of the community. Again, being particularly mindful that they are either directly or indirectly affected by the issue you're working towards. Then you want to conduct those interviews, of course, like you see before you. Contact those people you've identified, see if they're interested. It's about a 30 to 60-minute interview process. And then when you're conducting the interview, I'm sure many of you are familiar with a key informant interview or a focus group. It's pretty much the same standard kind of rules. Really avoid discussion with the interviewees, not really giving your perception on the things that you're asking about, but being able to clarify if you should be asked to do so, and using those prompts, of course. We, of course, encourage recording, either tape if you have permission or writing as they're given, so that you can really, dissect that later as you make notes and make sure you give a nice full representation of what you were told and you didn't miss anything. And then again, really not adding your own interpretation or second guessing what an interviewer meant. That can happen a lot if you don't actually have it recorded. And then there's a scoring process, like I mentioned, that you can see with actually in the manual to determine the dimension and really overall where that specific individual falls in terms of their readiness score. And so how do we use the information? Really, the ideal thing to do through that participatory planning process is involving the people you've interviewed, like I mentioned, as well as others that vary across sector representation, vary across being directly or indirectly affected by the issue, and really take a look at the distribution of the scores. Are they the same? Are they lower? And really identify where the inconsistencies or differences are. Make sure that you are able to do so that you can have some good conversations and to produce some specific plans along the way. We're going to look next just briefly at some goals and strategies per 9 stage that we just talked about. So starting with no awareness. So being mindful that the goal here is, of course, to raise awareness because none exists. So making maybe one-on-one phone calls to have some starting conversations and using some media platforms to kind of call attention to this issue. Those could be some specific strategies to work through the no awareness stage. To work through denial resistance, your goal again is to raise awareness that the issue exists. It's the same goal for a couple of these you'll see. And so some specific strategies or some steps you might be able to do is continue those visits, continue those two-way conversations, engage yourself in some programs that are already happening, be invited or asked to attend some local community groups and maybe have a few minutes on the agenda to talk about what's going on. And again, media can be a great ally, a great partner when you're trying to really disseminate broadly to begin increasing knowledge and awareness of an issue. Next is vague awareness. So here we're talking about a goal being to motivate individuals to use their voice. So now that people recognize the problem, they have to be aware that the community, that they can actually do something about this problem. So again, you'll see some similarities and some crossover, but presenting at local community events, maybe you're at a place where you can start to conduct some local surveys or conduct some interviews with some community members, and maybe even publish some editorials in some newspaper or some print. For pre-planning, the goal here is to really begin thinking about how this issue needs to be addressed. So perhaps we start to do some introduction of information through presentations or through the media again, Maybe we start to review some existing efforts in our community and continue some of that local data collection through maybe some focus groups, increased media exposure, as well as kind of reviewing with those invested in the community, such as community leaders, having some visits and reviewing some information with them as well. For preparation, you'll see that the goal is really about gathering information to begin planning strategies. So perhaps you're implementing surveys with school, community, maybe you're going to co-sponsor or sponsor a community event, and you're already thinking about evaluation and how you'll evaluate your efforts. Initiation's goal is to provide very specific community information that support programs. So you might be doing some in-service training on readiness. You might be attending meetings to share updates more regularly, being very public. Stabilization is really, as it reads, is to really stabilize those programs to ensure some sustainability of our efforts. So we might be doing some community events to continue garnering support, maybe even monetarily. Maybe we're doing some trainings, meetings, and doing some community recognition events, continuing with our media partners as well. Confirmation and expansion is to expand and enhance. So maybe we're starting to formalize our agreements, maybe through memorandums of understanding, some contracts, developing a speakers bureau, and working towards policy change. And then the high level, maintaining that momentum and continuing growth. So maybe we're working with local businesses to solicit funding, and we're also looking at how to diversify our funding sources so we're not stagnant. And we're also reassessing always, so important, so we don't lose focus or lose momentum, and we are tracking our outcome data and continually updating it. And moving kind of some shift into some organizational capacity. So really being able to understand that organizational capacity is really that process of establishing and arranging clear ways to work together. And it really supports the steps needed in creating a collaborative unit so that we're focused, we're progressive, and when groups really engage in this, we're able to kind of organize it, we're able to support our members, and we're able to see really nice outcomes. So being able to have some conversations of understanding organizational capacity, again, is that enhanced community participation. It's about really being able to clarify and connect people and opportunities, in fact, really to make those difference. It's also really active and it's very enhancing of collaboration, and also, again, working to avoid or address barriers like we've mentioned. And of course, at the end of it is promoting our program implementation, survival, and sustainability. We, of course, want to make sure that we are able to promote our task accomplishments, mobilize our resource in an effort to sustain our efforts. So some specific steps in how we do so is being able to understand that coalitions are our living entities. Its membership, its organization, its leadership evolves and changes over time based on the work, the strategies, and the activities. So that's when coalitions are currently engaged in the current time. So kind of focusing on that form follows function, how that coalition operates is best on the work it's doing. So understanding that coalition building really enhances the ability of its coalition members, our groups, et cetera, to really respond to current as well as future problems so that we don't ever lose that momentum, whether our substance changes, our funding sources change, what have you. We're kind of structured in our capacity to be able to adapt and respond should anything kind of come our way in that sense. I'll share with you as I close out just another example from a building capacity specific to another situation where locally some of our communities are starting to become community distributors of Narcan. And so really making sure that we spent some time assessing our community's readiness for that. And when we were met with some not so ready, we were able to deal with some of those concerns and misconceptions and build the capacity of those individuals so that they were able to understand the real purposes of Narcan and some of the other things that contributed to its use to really help mitigate some of those misconceptions and kind of that stigma associated with it. So just a great example there. So just kind of in summary, just some things to take away. You know, community readiness is so important. It's a great tool. Communities can't be convinced to approach an issue until they know they exist and how they affect their community. Communities really can't be forced into action, so again, being able to meet them where they are, and that organizational capacity really is such a critical process that should be implemented to produce that synergy as you move forward and move throughout. Take a second, we think we've got about 5 minutes to see if there are any questions.
That's great. Thank you, Ashley. One question that came in from the audience was in respect to working with stakeholders in the community. What do we do when there's stakeholders and potential community influencers who are not accepting of the experience of others? I'm picturing stakeholders who are possibly a little bit less willing to consider new perspectives or things that are outside their current approach to a challenge.
That's such a great question, and you know, it's so common, right? And so I'm glad that you asked. I think for me, and I can only speak for some of my own experiences, and I certainly don't have the magic answers for everybody, but something that has been successful in my work is that perhaps I would tweak who I brought with me in those conversations. And so perhaps it wasn't just me sharing information or me and my team who they expected to hear it from, but it was more of those constituents and those community level people, especially those ones directly impacted. Like I said, for some it worked. It was able to kind of change a little bit their way of thinking, and they were able to continue or to change some of their support in the work that we were doing. And then again, for some others, it really was more of a continued relationship building and thinking of all different ways to have them hear your message, maybe just not from the same voice.
Excellent. Another question that's just come in is, we struggle as a coalition to get volunteers to come to the table. How can we start to inspire people to be volunteering their time?
Another great question, and again, probably one of the most common struggles of coalitions, right, is getting people there. I would say being mindful on how you're framing what the coalition is or can do for the community and how it can impact them personally. So going back to maybe they don't have a direct connection to the issues you're working on, but could you highlight some ways that the issues are indirectly affecting them? If they're a person that's, wants to see their community thrive and succeed, those might be some different angles to approach how to get involved and how to use your time wisely in engaging help with coalition work.
And thank you. And I love this question. How do you move your stakeholders from being advisor-minded to action-minded? So I think a lot of times when we're dealing, especially with community leaders, we could talk to them about a problem and they start telling us what to do rather than joining in as partners.
I love that. That's a good one too. That makes me chuckle. I've got lots of stories about that, as I'm sure all of you do. I think it's helpful to maybe sometimes lean back on just reminding your group what it means to be a coalition, and I mean that sincerely, not sarcastically, but what a true working coalition is and what it means to have sector representation and sector voice, and how we are following a plan in place that we agreed to put together, and really just getting that group kind of vibe and feel and participation in terms of how we deliver our messaging and our work. That's definitely a tougher one, and I'm sure you're dealing with that, and it's very frustrating to be in that place. But I would just encourage you to keep forging on and being mindful in how you're participating with those specific people, maybe even challenging them with some specific tasks could be helpful to kind of take their shift from telling what to do to maybe challenging them to help you find some specific data or some specific previous examples of something that maybe worked elsewhere in another community. I don't know if that's helpful, but that might be something you could think about.
Excellent. And Ashley, we are coming up on the hour. Could you advance to my contact information?
Sure.
All right. Thank you again, Ashley. It's an excellent webinar. We do have one more webinar coming up next week, focused on building community coalitions for substance use prevention. So this is a great 101 towards all things strategic prevention framework. We'll be covering just some excellent information, especially what can we do moving from sort of the starting point and build that base for a coalition. I want to thank you, Ashley, and thank everyone for dialing in today. I will be in touch very shortly, probably tomorrow, as a lot of Washington, D.C. is snowed in today. We'll be in touch tomorrow with the slides, with a link to the recording of this presentation, and what I hope will be some useful resources for your work. So thank you.
Thank you, everyone.
And with that, we'll be closing the webinar.